So let's get started. This is reopening during COVID-19. What is next? My name is Valda Crowder. I'm an emergency medicine physician, and I also do some medical consulting. People call me Dr. V. So you, on each slide, you'll have all of my information at the bottom of the slide. At the website, which is AskDrV.us, you will see the original source articles for the research and the content that I'm actually speaking of. So you will not see the source documentation on the slide because it gets too crowded. I've been practicing emergency medicine now for 30 years. This is now my 4th pandemic. I've also treated people in a mass shooting and also in a hurricane, in a Category 5 hurricane. And so I like to do things for the community around what we actually need to do in times that are stressors such as this. The slide presentation will be 10 to 15 minutes, and then it'll be followed by Q&A. Usually we're done within an hour. The presentation is essentially the same from week to week. I do Tuesdays and Thursdays unless I'm actually working in the emergency department. And we update the slides based upon what's actually going on in the news or in with research that has come on board since the last presentation. During the presentation, everyone is in listen mode. You can ask questions through the chat icon, or you can also type in questions through the Q&A. And then when we come off of the slide presentation, we will first go down the questions on the Q&A and in the chat. We will open it up for people to ask questions depending upon the number of people and the time. The intention of the webinar is to keep all participants informed about COVID-19 science, so it will help them and their families stay healthy during this pandemic. The outcome is that you will leave the webinar motivated to create an action plan for you and your family around reopening, and create an action plan for your broader community. So a little bit about COVID-19. This is basically a disease of people and surfaces. So the disease spreads from person to person, from small droplets in your nose and mouth that people either pick up on surfaces or they breathe in. It's highly contagious. It takes 45 seconds of exposure to become infected. It has a penetration rate of 60 to 80%, which means if 100 people come in contact with it, 60 to 80 of them will actually get the disease. If you look at something like influenza, influenza has a 20 to 30% penetration rate. Minimum number of droplets is 1,000 droplets to actually become infected with COVID-19. There's a lot of science around viral load. So if somebody has a higher viral load, that means that maybe they got exposed to 10,000 droplets as opposed to 1,000. The droplets stay on surfaces for a very long time. Cardboard surfaces for 24 hours, plastic surfaces for 96 hours, metal surfaces for days. So when you actually look at someone coughing or sneezing, you can see that it can then spread in a lot of different areas. And along this 3 feet and 6 feet, there are objects. There might be a public bench or a public chair or a computer or a countertop or a chair. And these are all surfaces that you can then later on come back around in that 24 to 96 hours and become exposed to. So let's take a look at the risk, okay? A toilet being flushed without a closed seat releases 8,000 droplets into the air. A cough is 3,000 droplets at 50 miles per hour. A sneeze is 30,000 droplets at 200 miles per hour. A breath is 50 to 5,000 droplets. And speaking, depending upon the voice, and someone speaking louder is actually releasing more droplets. But 5 minutes of speaking face to face is the required dose of 1,000 droplets to actually become infected. So this is why it's very, very important that you wear a mask for yourself as well as wear a mask for others. Transmission rate. Transmission rate is what we call the R number. We call it R naught. I have not heard anyone say what the transmission rate is in the US. Worldwide, COVID-19 is 5.7. The Spanish flu in 1918, which people talk about a lot, that had a transmission rate of 1.4 to 2.8. So as you can see, this is a really, really high transmission rate infection. Germany has set the R naught for less than 1, and that is what they're using as a criteria for reopening. I think for us, it's very dangerous because no one is saying what the R naught is. And so I believe that it's probably much, much, much more than 1, probably much, much more than 5, and we're going back to work. Proper hand washing. There's a lot of stuff around proper hand washing. I always put in this slide because I think it's important. Most people do the palm to palm hand washing, which is slide 1. But it's very important to do 2 in between the fingers, 3, which is the back of the hand, 4, which is the base of the thumbs, 5, which is the back of the fingers, 6, which is underneath the fingernails, 7, which is the wrist, and then 8, which is rinse and dry. This slide here shows what happens when you don't do proper hand washing. So slide 1 is the dirty hand, and the hand gets darker as it gets cleaner. So if you rinse the hand with water and just shake it, you see you don't really do that much. 6 seconds of washing with no soap is slide 3. 6 seconds with soap is significantly better in 4. 15 seconds with soap is slide 5. And 6 seconds of slide 6 is 30 seconds with soap. So the recommendation right now is 20 seconds with soap, which would be in between slide 5 and slide 6. The power of social distancing. The way we were living before, 1 person would infect 406 people in 30 days. When you do the lockdowns, you have 75% less exposure, and 1 person then infects 2.5 people in 30 days. So when we go over the symptoms, we've talked a lot about this on our presentations. You don't have to have any symptoms. You can be completely asymptomatic. One of the earliest symptoms is loss of taste or smell. Sometimes people have a decreased appetite, nausea, vomiting, diarrhea. We are now seeing blood clotting, which is a clot in the legs, a clot in the lungs, or stroke. This is how come most people are mislabeled and maybe labeled as not as COVID related because somebody thinks they just had a stroke. Then the other thing is the respiratory symptoms that people talk about: headache, fever, dry cough, difficulty breathing. Then there's also COVID toes, which we particularly see in young people. And this is just a picture of what it actually looks like. Kind of like a reddish bluish discoloration of the toes. It's usually fairly asymptomatic. Maybe if there's some swelling, people may have some pain related to the swelling, but it's not particularly painful. It is alarming to people, so they bring themselves or their kids in related to it. Asymptomatic transmission rate is about 50%. We've seen this now in a variety of settings. Cook County Jail, the Theodore Roosevelt in the Navy. Iceland also saw 50% of corona cases have no symptoms, and we also saw it in Rouen, Italy. So that's been fairly consistent, and that's fairly troubling in that we have to actually test asymptomatic people. We have to test people that do not have symptoms to get a handle on this virus. Risk factors: anyone born before 1955. And I think that's a very important criteria to think about rather than the elderly, because none of us think we're elderly, even though we might be born around that time. So born or on before 1955, living in a nursing home or long-term facility, any sort of asthma, COPD, emphysema, heart disease, immunocompromised, which could be cancer treatment, but it also could be HIV, lupus, rheumatoid arthritis, sarcoidosis, or someone who's at a transplant. People who are pregnant are also predisposed. And the other thing that a lot of people are not talking about, which we're seeing clinically a lot, is severe obesity as a risk factor at any age. In Japan, they've actually had 2 sumo wrestlers in their 20s die. And that is defined as a BMI over 40. So a BMI over 40 is these height and weight criteria: 5'2" over 220, 5'6" over 250, 5'10" over 280, 6 feet over 300. And that is a BMI over 40. And those people are, again, they're at risk at any age. Men are more likely to get this infection. There's something about them that they have a protein or something on the surface of their blood that allows this to attach and get in more readily than women. They're also more likely to die from it. People with a blood type A are more vulnerable. People with a blood type O seem to be protected. Again, this seems to be related to the proteins that are on the surface of the cells. Anybody smoking or vaping is more likely to get the disease. We're seeing a 40% of our patients that are hospitalized are between 20 and 54. So what's next? It's very important that we risk stratify activities. High risk activities, public transportation, airline travel, going to the restaurants or movies, any place that's enclosed, gambling, going to a work cafeteria or break room. Medium activities would be ride share, pickup, takeout, grocery shopping. Low risk activity would be walking, biking, going to the park, having your food delivered, Zoom meetings, conference calls, bringing your lunch or snacks to work and then sitting outside and eating them. So it's very important that employees and jobs risk stratify as we open up. So there's certain high risk jobs, manufacturing, armed services where you live in close quarters, particularly the Navy. Any public-facing business, restaurants, hair, nail, salons, transportation, hotel, airlines. As you see these areas opening up, these high-risk businesses, one thing you should look at is you don't see the doctor's offices reopening, okay? So I tell people, you know, be very wary. If you can't go to your doctor's office, you probably should not be going to get your hair done. Medium risk jobs or office work, depending upon how the office is laid out. Low risk jobs obviously would be parks, recreation, landscaping, and construction. A lot of folks have wondered, you know, do they need PPE? And a little bit about PPE. These are the masks and the medical gloves and everything that people use. It's very important that people actually know how to use PPE because you can actually contaminate yourself by not taking off your gloves correctly or not taking off your mask correctly. But this is actually what PPE actually looks like. Questions to ask your employer: can I work remotely? If you feel like you are working in an environment where you need to work remotely and you're not being allowed to, you should consider getting a doctor's note if you feel like you have risk factors. What sort of PPE will I receive when I go to work? You should ask that before you get there. Can I get tested for COVID-19 at work? If I can't get tested at work, how do I get tested? Where are my testing sites in my community? If I get sick, do I have sick leave? Do I have access to telemedicine services? Does my company allow me 14 days paid sick leave if I need to be quarantined? Sometimes what they will say is, well, we allow 14 days sick leave if you get a COVID test, but then it's difficult, it's almost impossible to get a COVID test. A more responsible employer would say, you can't come back to work unless you have a COVID negative test. And then, you know, you have to go in and actually get a prescription and get some, and get passed and cleared. So a couple of things from the May 12th hearing with Dr. Fauci, and I'll add even a couple of things from the hearing today. He cites serious consequences if places open too quickly. There's a deadline that has been set for a testing plan to be released to the public by May 24th. They also said that a vaccine will not be ready in time for the new school year. And they're also ramping up and hiring contact tracers because we previously did not have the infrastructure to really properly monitor the virus. So we're now nationwide actually hiring contact tracers and beginning the work of actually tracing this virus and those that are exposed. This is all of my basic information and sort of how to get in contact with me. I have some communities, sororities, and Chamber of Commerces that are asking me to do specific presentations for them. So you can just send me a note there or reach out to me, and these are the ways to actually